Hello, I'm Chuck Smith, the CEO of Innovative Health Media. I have been an RN for over 17 years, primarily in ER, ICU, and trauma. I created the e-AWV system with the assistance of physicians, educators, patients, caregivers, and geriatric specialists to provide a streamlined formula for clinicians to provide the Medicare Annual Wellness Visit while helping to ensure all the Medicare requirements are met. Today, I want to give you a quick overview of the e-AWV system and how it can benefit your practice by improving patient satisfaction, wellness, and promoting additional services such as cognitive screening, pharmacogenetics, and more. To start off, let's learn what the Medicare Annual Wellness Visit actually is. The Annual Wellness Visit, or AWV, was created as part of the 2010 Affordable Care Act. The AWV is not a diagnostic visit and is not a physical exam. It is an educational visit designed to educate the patient on their own health status and measures they can take to maintain or improve their health. It is the first step in a national policy shift toward prevention before treatment. In order to incentivize physicians to offer the annual wellness visit to their patients, Medicare has set the rates at more than 2.5 times the standard evaluation and management office visit rate. The initial AWV, using rate code G0438, pays an average of $170. Subsequent annual wellness visits average about $120 using rate code G0439. Since 2011, the reimbursement rates have increased an average of 7% each year. In addition, knowing that a physician's time is very limited, Medicare decided to allow any licensed medical professional to perform the AWV. A nurse practitioner or physician assistant can perform the AWV at any time, any place. In order to receive full reimbursement, they need to bill under the physician's NPI number, which is allowed. An RN, LPN, physical therapist, or even a licensed dietitian can perform the entire annual wellness visit within the office as long as the physician is in the suite and available for immediate consultation. An MA or CNA can perform the AWV as long as the physician or NP sees the patient and reviews the information before the patient leaves. Although any physician can perform and be reimbursed for the annual wellness visit, it is best done by primary care practices who have a better overall understanding of the patient's health. Naturally, internal medicine, family practice, general practitioners, and gerontologists should be included. But let's not forget that some cardiologists, pulmonologists, and even OBGYNs act as primary care providers for some of their patients. I've already mentioned that Medicare has a very high reimbursement rate for physicians, but how much does it cost the patient? The annual wellness visit is totally free to all Medicare and Medicare Advantage beneficiaries, and there is no copay. The AWV can be repeated every 11 months. There is no medical necessity requirement, and it can be performed during the same visit as other procedures. It's important that the patient be made aware that although the AWV is free, they may have a copay for other procedures performed during the same visit. The only other eligibility requirement is that the patient must be past their initial 12 months in Medicare, and they must wait at least 11 months after their Welcome to Medicare exam or last AWV. Medicare recommends using diagnosis code V70.0 for the annual wellness visit. Now let's move on to the Medicare requirements. There's a lot of confusion among providers, and many mistakenly believe it requires a physical exam. It's important to understand that the AWV is not a diagnostic visit. It is an educational visit. There are many very specific guidelines that must be met for reimbursement. Failure to meet these guidelines can result in charges of Medicare fraud and repayment of all funds received for annual wellness visits. As I said, there's a lot of confusion about the AWV requirements. This is why. These 5 pages are the quick reference guide to the annual wellness visit, which is provided by Medicare. Is it any wonder why clinicians don't understand? Let's look a little closer at some of the fine print. These are the specific requirements physicians must meet during the annual wellness visit. Failure to meet just one of these requirements can result in needing to repay funds to Medicare. I'll just be quiet here for a bit so you can peruse this page. Now, let's jump over to that next peak and take a quick look at the e-AWV system. This is the e-AWV system. It is a cloud-based, HIPAA and high-tech compliant service that can be accessed from any internet-enabled device, although it is easiest on a laptop or desktop computer. The e-AWV is designed to be very intuitive, easy to use, and to save significant time in your practice. The screenshot you see is the layout clinicians will use during the AWV. Near the top are 6 tabs that guide clinicians through the different parts of the AWV. The first 4 tabs, Health, Medications, Health Team, and Immunizations, can be completed prior to the visit from the existing medical record. Then a simple confirmation and updating of new information will complete those tabs. The 5th tab is the health risk assessment required by Medicare. It includes the vital signs, BMI calculator, sensory issues, functional ability, cognitive screening, depression, and other screenings. Each of these sections can automatically trigger either a referral or medical necessity for additional procedures. The e-AWV health risk assessment is purposely limited to meet the specific Medicare requirements without requiring 20 minutes of exhaustive questioning of your patient. Because this is not a new patient, there is no need to duplicate information that is already in the existing medical record. Remember, this is not a diagnostic visit. The AWV is simply to determine if the patient needs additional evaluation or screening. The 6th tab is the Advanced Directive page. This tab allows a clinician to automatically print an advanced directive for the appropriate state. The patient can then take the form with them to be completed at a later time. As I mentioned, the e-AWV can justify medical necessity for additional procedures that can be referred internally for an additional revenue source for the practice. If a procedure is performed in conjunction with the AWV, the practice must notify the patient that copays may apply for those procedures, and give the patient the option of opting out of those procedures if a copay is required. The e-AWV is the only system that creates a proprietary, patent-pending solution for your patients by providing a comprehensive, yet easy to understand, personal health record that can only be edited by the clinician, but with access controlled by the patient. The patient will walk out the door with a printed personal health record as well as an access code for the online version, which they can share with their loved ones or caregivers for easy access in case an emergency occurs. You will have the ability to update the record for the next 11 months, at which time the patient is eligible for a new e-AWV. The previous year's information will automatically populate the new file, so all you will need to do is a quick update and a new health risk assessment. As an ER nurse, I can vouch for the absolute necessity of having access to this information when a patient arrives in the ER. Rapid access to information can be the difference between life and death. This is why a wallet-sized card is also printed, so the basic information will always be available whether the patient can communicate or not. For the practice, a PDF file can be saved to your EHR program, or a condensed physician version of the e-AWV can be printed and placed in the paper record. We hope this video has answered any questions you may have. Your sales representative can set up your account immediately, or you can log directly into e-AWV.com and sign up yourself. You can be providing annual wellness visits in just a few minutes. If you have any problems with setting up your account, you can just click the support button at the top of the e-AWV screen to view the support videos. If you have any additional questions, be sure to contact your sales representative, or you can email us at sales@informthepatient.com.